epidemiologist and science communicator teaching at the University of Ottawa. And Raywat is with us now. Hello, how are you?
I'm fine. How are you?
Excellent. Now, being a science communicator in this climate must be kind of a tricky job
Oh
because
man,
tell
it's
me
been a
about it.
nightmare. It's been a nightmare. I gotta say. I mean, we start out thinking about science communication as just the endeavor of explaining how things work to people, and now it has become a deeply politicized and divisive sort of endeavor, and that was not expected. We did not anticipate the deep extent to which miscommunication has been weaponized. And we're deep in it now. This is a whole new ballgame now. The pandemic has opened up a can of worms regarding how words are used, how they're misused, and how they're weaponized.
Yeah, it's interesting because it seems like I'm hearing the phrase American-style politics. And I've been wondering, what is American-style politics? And I think I've decided American-style politics is when there are two deeply divided sides and they can't agree on things we used to agree on.
I think
Science.
yeah, that's pretty accurate. And also, I think it's intentionally dividing people when they don't need to be.
Right. Well, let's talk about the phrase vaccine passport versus whatever else you want to call it, immunization record. I mean, do you feel that phrase is not helping?
It's not helping. Now, changing that phrase won't solve our problems, but it'll help a little bit. Think about what passport means to many people. There was a time when a passport was just a thing you carried to show who you are, and it was your entry into the world. These days, a passport is seen as a restrictive measure that prevents you from accessing another country. So usually it means you're presenting it to a uniformed official who will then scrutinize you, give you a once over with a judging eye, and maybe prevent you from accessing a nation that you feel you belong to. So it has a negative connotation these days. In many ways, the vaccine passports, the way they're being used now domestically, can be considered social licenses, which is even worse. It's saying these people have a license to socialize and those people don't. So what it really is just a value-free document with no morality implicit in it. And we have to struggle to find a term that does not trigger people unnecessarily. And there is no obvious way to go with this, but I think it's worthwhile exploring.
That's interesting because a lot of the people that I communicate with and know that do not like the vaccine passport, they often argue in a very sort of abstract way. It's our freedom. It's our freedom, and the way you describe it, where you picture uniformed officers looking at your document and letting you go or not let, it has a sort of a 1984 Big Brother feel to it.
That is the way it is being portrayed by those opposed to it. And I'm sympathetic, but it's not an accurate portrayal for a number of reasons. One is, in many ways, the vaccine passport, if you want to call it that, allows people to do things they could not have otherwise done. It allows the freedom and safety of movement that otherwise would not be there. Second of all, it's not interminable. This is going to last a few months at the most, not many years as many people claim. Third, many manifestations of the vaccine passport around the world, the Israeli Green Pass, for example, the South African Excelsior Pass, make accommodation for people who are not vaccinated. For example, they acknowledge people who have got COVID and recovered as being immune, or people who had a recent negative test. So you still can access aspects of society, you just have to jump through a couple of extra hoops, and no one's being excluded. So, and then the last reason is we already have plenty of precedent for this in society. You can't cross the street wherever you want. You got to wait for the green light. You can't drive your car as fast as you want because that's against the public good. You need a license to drive a car, right? So we already restrict people's movement for the greater good. This is just one more manifestation of that restriction, and it's a temporary one.
That's right. And I had a story yesterday about a doctor in Florida who was getting a lot of flack because she sent a letter to her patients saying that if you weren't vaccinated, you couldn't have an in-person visit to this doctor. It would have to be on Zoom or whatever they used. And she was getting a lot of flack for that. But a lot of other people pointed out that doctors' offices have been doing this for years and years, especially pediatricians.
Absolutely. And schools, most schools, well, every public school in Canada has a required vaccination before you can attend that school. The military requires, was it 13, 14, 15 vaccinations before you can serve in the military? We have a lot of precedent for restricting people's access based upon their choices, their medical choices that they make. By the same token, you can't get service in a restaurant unless you're wearing shoes or a shirt. And this isn't discriminatory based upon who you are or things that you cannot change. It's discriminatory to the extent that it is discriminatory based upon your choices. You can choose to get vaccinated. You can choose to wear a shirt and shoes. You can choose to get a driver's license. So it's in your power to acquire this document to access these aspects of society.
It's been a long time since I've seen a sign that said no shoes, no shirt, no service. But I guess that was in the 60s when there were a lot of hippies or something.
I'm older than I look.
No, it's funny because it's a no shoes, no shirt passport if you're wearing shoes and a shirt. But let's talk about, we'll take a break. And when we come back, I want to talk about how this misinformation is spreading. And sometimes it's misinformation and sometimes it's just words, I guess.
Right.
And we'll talk more with Raywat Deonandan, an epidemiologist and science communicator teaching at the University of Ottawa. That's when we come back. I'm Martin Strong.
When you drive a Jeep, every day is an adventure waiting to happen. A trip
Talking about the power of words like vaccine passport versus immunization record. Our guest is Raywat Deonandan. He is an epidemiologist and science communicator teaching at the University of Ottawa. And another word that we're hearing a lot of is anti-vaxxer. How do you feel about that word? Is that a divisive word?
It is a divisive word. It does refer accurately to a certain contingent of people who are resistant to vaccines, but not all of them. Especially this particular vaccine, where a lot of fear has been stoked by a variety of agents around the world. So amongst the vaccine resistant, I would include the anti-vaxxers as the extreme corner of them. And they're kind of like a religious movement in my mind. They're actively opposed to rational thought, frankly. I don't know how to deal with them because I don't know how to argue with religion. Then below them, I think there are the vaccine hesitant, who are just awash in misinformation, who have been assaulted on Facebook with all sorts of strange, scary stories. And for them, we need to reach out and really be caring and empathetic and understand where their fears come from and meet them with better data. Then there are the apathetic, people who have nothing against vaccination. They just don't feel that they need this particular one, and they feel that they're young and strong and probably have a strong immune system and don't need vaccines. They're the ones that vaccine passports really work against, by the way, because they provide an incentive for them to not be apathetic. Then there are those who have nothing against vaccines, who want to be vaccinated, but they've got childcare issues or work issues. They can't get time off to get vaccinated, or they're afraid of the side effects. And for them, we need policy levers like paid time off or childcare relief. There are a variety of tools we can apply to target most of these groups, but the hardcore anti-vaxxers are the hardest to reach because their heels are dug in, and this is a belief system for them.
Right, and so I guess it's sort of sounding as if, anti-vaxxers are, you're sort of writing that off, but it's the vaccine hesitant that could really be helped. And give me some examples of stuff that you see maybe on social media, that disinformation that perhaps the vaccine hesitant are seeing, and this is causing them to be hesitant.
The early ones were things like the vaccines are genetic therapy that rewrite your DNA. They're not. They're downstream from your DNA, or they will cause you to be infertile. They don't. If that were the case, then all the people recovering from COVID would be infertile, and they're not. Or we have people playing with the statistics, talking about how the half of the cases in Israel in hospitals are vaccinated, therefore the vaccines don't work. Well, that's the case of a statistical illusion called the base rate fallacy. So you sit down and explain how the math works, and that usually assuages that concern. There are a variety of things, and new ones pop up all the time, and sometimes I scratch my head thinking, how did anyone think of this? For example, for a while, people were afraid that vaccinated people could infect other people with the spike protein that they're exhaling somehow and causing pregnant women to miscarry. So a lot of storefronts in the USA had signs saying, if you've been vaccinated, you're not welcome here because we have pregnant women. So I don't know how these things get a life of their own. I know that there are disinformation agents who actively seek to weaponize misinformation to get a certain outcome in the population, and they're probably funded by some agency there or other. But mostly, I think it's just people who are afraid and who aren't trained in the proper reading of complex science, make a faulty conclusion, share it with their friends, and don't follow up with further investigation.
Right. And what about things like I forget the name of the medicine. It was in the Trump days. It was and
Hydrochloroquine.
everybody, hydrochloroquine,
Yeah.
and everybody was taking that. And the new one is ivermectin,
Yeah.
which is the horse dewormer, but it's also a human drug. Like people do take ivermectin, right?
As far as I know, I don't know for sure. It's not my field. Yeah, the issue with those kinds of medications is one, they've been politicized. So a certain contingent is so bent on being anti-vaccination that will cling to the slightest statistical signal that suggests that there's another option. And the other thing is, people aren't well trained in how to assess evidence. And this is a difficult topic. There's a reason we have professions dedicated to weighing evidence. Just because a doctor observed it to maybe work in practice doesn't mean it actually works. That's the beginning of wisdom, not the end of it. That's why we need well-controlled, randomized controlled trials, several of them, combined into a meta-analysis that assesses them for quality. And then from that, we distill actual clinical practice guidelines. That's why it takes long to figure out if something works. For a while, we thought remdesivir was the great salvation for COVID. Then it was hydrochloroquine. Now it's ivermectin. And none of those drugs passed that final evidence threshold that tells us if it works in real life or not. So that's the challenge here, is educating people to understand why evidence is so difficult to assess. If it was easy, everybody would be doing it. But it's difficult and it's expensive.
And it's kind of ironic because a lot of people who are anti-vaccination say, "Oh, not enough testing has been done. It was rushed through." When ironically, a lot of testing has gone through. They've had years and years before the pandemic to work on these kind of viruses, and it's the hydrochloroquine and the ivermectin that hasn't really been tested.
That's exactly right. The mRNA vaccines, they sound new and they're exciting. They're science fiction kind of technology, but they've been theorized for years and they've been worked on for years. And we actually have one that worked in an animal population for a while. So there is a long track record here. And the reason we got these vaccines so fast isn't that they're rushed. It's because we threw a lot of money at it. Right? So if you can pay for randomized controlled trials in the order of tens of thousands of people and have 20 going simultaneously, a few of those are going to pan out quickly. That's what happened here. And that's actually inspiring. It means we can apply the same strategy to any number of diseases and solve huge public health crises faster than we have in the past simply by spending money.
Right. And as an epidemiologist and science communicator, it must be disheartening to see what just happened, which you said that all of this manpower and women power and money that was thrown at these vaccines, really a miracle of science. And the fact that they're not unanimously being heralded as just a marvel of human achievement must be very frustrating for you.
It's heartbreaking. That's what it is. When I first heard that we had vaccines coming to market by the end of last year, this was a miracle. Many of us were in tears, and we thought for sure a number of Nobel Prizes would be given out to the manufacturer of these vaccines. Somehow science pulled civilization out of the fire. And here we are a year later, looking at a fourth wave, and it's frustrating because we have the tools to stop it. That's the thing about now as compared to last year. We have the tools to get to some semblance of normal fast. And those tools include vaccination at scale. They include rapid tests. They include mask wearing. And yet the resistance to this is phenomenal. So we have no one to blame but ourselves for the predicament we're in right now. Before, we could have blamed the virus. Now it's entirely human mediated.
Right. And we just had a French language debate. We've got the English language debate tomorrow. And I mean, all of the leaders basically are pro-vaccine, some to a lesser degree, some a little more, a little less than others. But what would you like to hear from the politicians, both provincially and federally and municipally,
Right.
about vaccines and about the language that they use and all that stuff?
A number of things. One is, I think we have to have a national vaccine passport, call it something better than that, obviously, but some strategy for empowering institutions to control who comes in through their doors. And the reason for that is, one, we want to incentivize vaccine uptake. Two, we want to make sure that the unvaccinated aren't in super spreading environments. Three, we want to make sure the businesses stay open by not being home to super spreading events. And four, we want to make sure that the vaccinated aren't unnecessarily exposed to the unvaccinated rather, and causing breakthrough infections. That's number one. The second thing is, I think we need to want to make this pandemic go away in months rather than years. And the way we do that is by pressuring our leaders to make vaccinating the world a priority. The world. This doesn't go away until the world gets vaccinated. And this has to be a Manhattan Project level endeavor to produce and distribute as much vaccine as we possibly can. And the last, yeah. And I was going to say that the last thing I want to say is, I think we need a rallying cry to combat the misinformation, to stop the divisions of society, to understand that everybody wants this to go away. Everybody. And the way we do that is, as we mentioned, we use the tools at our disposal, including rapid tests. And so that hasn't been fully explored yet in our country, and it really should be. It's a fast way for us to identify who's infectious and self-restrict our movements so that we don't infect others. And that way we can keep everything open, schools included.
Well, thank you so much. Raywat Deonandan, an epidemiologist and science communicator at the University of Ottawa. And when we come back,